I'm Dr. Patrick O'Shaughnessy. Thank you for joining us for today's episode of CHS Presents Health Connect. Catholic Health Services is an integrated healthcare delivery system with some of the region's finest health and human services agencies. CHS includes 6 hospitals, 3 skilled nursing facilities, a regional home nursing service, hospice, and a multi-service community-based agency for persons with special needs. Under the sponsorship of the Diocese of Rockville Center, CHS serves hundreds of thousands of Long Islanders each year, providing care that extends from the beginning of life to helping people live their final years in comfort, grace, and dignity. CHS is focused on quality, and through this show and many community health initiatives, we promote good health and provide you access to the care that you may need. I'd also like to thank and recognize each of CHS's 22,000 employees and affiliated medical staff members for their ongoing commitment to quality and service excellence, which is evident at each and every patient encounter. You are all the face of CHS, and we thank you for all you do for our patients and residents every day. St. Catherine and St. Charles Center for Health and Wellness is comprehensive and convenient. In one location, patients can access primary care, women's health, diagnostic imaging, rehabilitation, and all orthopedic services. To speak more about St. Catherine and St. Charles Center for Health and Wellness, I'll be joined by Dr. Dimitri Christoforou, an orthopedic surgeon at St. Charles Orthopedics, and Dominic Pernice, Director of Imaging Services at St. Catherine of Siena Medical Center, St. Charles Hospital, and the Center for Wellness. Please stay tuned to today's episode of CHS Presents Health Connect.
Food. It nourishes, brings us together, and adds flavor to life. That's why it's important to wash hands, surfaces, and fresh produce. Keep raw meat, poultry, and seafood separate from ready-to-eat foods like fruits and vegetables. And cook to proper temperatures using a food thermometer. Enjoy! And refrigerate leftovers within 2 hours. For more tips on safely preparing foods, visit homefoodsafety.org.
I never wanted to be associated with heart disease. I never wanted to be the poster child for heart disease. I never wanted people to know that there was something wrong with me.
Going through recovery from open heart surgery or being affected by heart disease can be incredibly isolating.
It's not easy on your body, on a woman's body.
I felt really alone because no one my age really had this problem, never had this issue.
And just knowing that there's a circle of women who know exactly the struggles I face every day and are there for me is so empowering.
I realized that I wasn't alone, and no matter your age or race, I made friends and found sisterhood and really found a second family that made me feel that I wasn't alone anymore.
There's so many ways that you can get involved. You can join the movement, you can volunteer, you can be an advocate, and you can donate. All you have to do is go to goredforwomen.org.
There's a shelter pet who wants to meet you. Meet one today. Visit theshelterpetproject.org. Adopt.
Grandpa, look what I got. Let me see.
Oh, Dad, wait till you see the bike we got for Jake.
Hearing loss happens gradually with age, making it easy to ignore. Yet most older Americans aren't getting their hearing tested. Untreated hearing loss can keep your loved ones from enjoying what they cherish most.
Dad, can you hear me?
Don't let that happen. Speak up about hearing loss. You'll be glad you did.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But I get it, you're busy, and busy people can't have prediabetes. I read that wrong. They can, okay? Just go to the site.
Welcome back to CHS Presents Health Connect. St. Catherine and St. Charles Center for Health and Wellness combines excellence in imaging with top orthopedic specialists. The diagnostic imaging services are state-of-the-art, accurate, and comprehensive. The facility is convenient, offering a team approach and a supportive atmosphere. With us is one of the key orthopedic specialists, an expert in hand issues and hand surgery, Dr. Dimitri Christoforo of St. Charles Orthopedics. So, Dimitri, welcome to the show.
Thanks for having me.
Tell us a little bit about the types of services that are offered at the center.
So the new center is an exciting new opportunity for us to provide a complete gamut of orthopedic care to the community. We've got specialists, board-certified, fellowship-trained specialists in hand and upper extremity surgery, shoulder surgery, hip and knee reconstruction, sports medicine, both operative and non-operative, pediatrics, as well as foot and ankle. So really an entire opportunity to provide all forms of services for all of our patients.
And there's also women's health services there and primary care services. They're tied in with physical therapy and the imaging. So really a full comprehensive center.
Full center. The imaging center is right next door to our suite. So it's immediate access for our patients to be able to get any kind of ultrasound imaging, CT, MRI, X-rays. It's really all right there in one place.
Now, we're very fortunate to have you on our team. I mean, you are a specialist within a specialty, right?
Correct, that's right.
So tell our viewers a little bit about what is a hand surgeon and the types of procedures and services that you would offer.
So as a hand and upper extremity surgeon, we essentially cover care for the entire extremity from your shoulder down to the fingertips. Take care of shoulder injuries, elbow injuries, wrist, hand injuries, nerve injuries, vascular problems, things like tendinitis, arthritis, carpal tunnel syndrome, cubital tunnel syndrome, and a lot of trauma, fractures. Essentially take care of that entire range of injuries and diagnoses.
So all of that, and some of the most interesting and common diagnoses you just mentioned. Let's talk a little bit about degenerative joint disease and arthritis. Very, very common. Sure. The whole theory behind inflammation and what it can do to you, especially your joints. Sure. Tell our viewers a little bit about, are there ways that we could minimize or prevent damage of degenerative joint disease?
So arthritis is a kind of general term that we use to describe any kind of degeneration or wearing down of the joint surfaces. The body is designed in such a way that the joints have this coating known as cartilage, which protects our bones from rubbing up against each other. Over time and over the years, that cartilage becomes thinner, and as that becomes thinner, the bones can start to contact and form what we know as arthritis. And there's different forms of arthritis, rheumatoid arthritis, various inflammatory arthritis problems, but the most common one is degenerative.
Yeah.
Unfortunately, a lot of that is genetic, and if it runs in the family, there's a good chance you might end up with it as well. But certainly keeping active, keeping a well-balanced diet, obviously trying to avoid injury, any kind of high-impact sort of activities. The more you can minimize those, the less chance you can potentially put yourself to get these kinds of injuries in the future. But it's a super common problem. We see a lot of that, and it's a problem that we've really come a long way in terms of figuring out how to take care for.
Sure. Now, you mentioned injuries, and this one is near and dear to me. My dad was a New York City police officer, actually had a fracture in his wrist that actually led to avascular necrosis, which wound up making him get retired. So talk a little bit about, it's very common. People can fall on an outstretched hand, have an injury. What should they be thinking of, and when should they come in to be evaluated, especially at a center like the new center in Comac, where there's state-of-the-art diagnostic imaging, top orthopedic specialists? You don't want to miss an occult or hidden fracture.
Correct. It sounds like your dad had something probably called a scaphoid fracture.
Correct.
Which is actually, unfortunately, a pretty common injury that you see in athletic, active people. They tend to fall, try to break their fall by putting their wrist down, and they fracture a small bone, and it's a scaphoid. That particular bone has a poor blood supply, so if it doesn't heal appropriately, it can actually go on to necrosis or death. When that bone dies, it can cause all sorts of problems for people in the future, like arthritis, post-traumatic arthritis, etc. Typically, when you have an injury like this, you have a fall, you notice some swelling, you notice some bruising. First thing you want to do is you want to put some ice on it, you want to mobilize it, give it a little bit of time, see how you feel, and if it's not really getting better and you notice that it's getting more swollen and more painful, probably a good idea to head to call your physician or head to a local area to at least get an x-ray. Nice thing about our facility, like I said, is we can get patients in relatively quickly. We try to get our patients in within 24 to 48 hours. All of the imaging is on site, so we can have a diagnosis and a treatment plan for you all in one shot.
I actually heard as people could come in and see you, by the time you're done evaluating, you send them down the hall, get the imaging study. Many times the diagnosis, the read is back, and you have your plan all enacted
Absolutely.
already.
Our musculoskeletal board certified radiologists are spectacular. They'll read our imaging studies almost immediately. So we've had lots of patients over the last couple of weeks that we've seen in the office and sent them straight to the CAT scanner, to the MRI machine, and seen them right back and been able to go over the results and formulate a treatment plan right there.
That's great. Now, common overuse syndromes. You're an expert in so many different areas of the upper extremity. Talk a little bit, though, about some very common ones. You talked a little bit about carpal tunnel. People are on computers all the time. And for those that are athletic, whether it be golf, hockey, whatever, elbow issues.
Right. So I think you hit the two probably most common things I see in the office. Doc, why are my hands numb and tingly? I wake up in the middle of the night and I feel numbness. I use a computer all day long. That's sort of the common things we hear about when patients come in with carpal tunnel syndrome, which is a compressive problem of a nerve in the wrist. Extremely common. It tends to be progressive, so we like to try to treat these sorts of problems initially when we first see our patients. But carpal tunnel syndrome is a big one. The other common one is, like I said, tennis elbow, where probably the most common cause of lateral or outside of the elbow pain that we see in the office. Not necessarily need to play tennis to get tennis elbow, but we see it a lot in active patients, especially as we get a little bit older. After the age of 20 or 30, unfortunately, our tendons get a little degenerated and predisposed to see these tendon injuries, and tennis elbow is certainly one of those.
So again, these conditions, although very common, very easily diagnosed by the proper skilled physician with the proper diagnostic tests, proper treatments, can put people back on the path to health and wellness.
Absolutely, absolutely. Physical therapy is a great one for these, and the nice thing again about the facility is we've got that on site as well.
You have it all on site. So how about osteoporosis? Very, very common. Again, certainly a genetic component to that as well. But what could we do to diagnose this earlier and perhaps even prevent or delay progression of the disease?
So osteoporosis, big problem that we face, especially more common in women as they get past the ages of their late 40s into their 50s, go through menopause. A lot of their hormonal levels change, which can predispose them to developing something known as osteoporosis or osteopenia. There's three particular types of fractures that define what we call fragility fractures, which are fractures of weak bone. Those being distal radius or wrist fractures, vertebral fractures, and hip fractures. So we see a lot of these injuries, unfortunately, in a lot of our patients. And once we see that, it's almost like a signal for us to kind of further work them up and evaluate their bone density. As the bone becomes weaker and thinner, they become more predisposed to fractures. So there's all sorts of medical as well as surgical options for these types of patients. But the best key to helping this is prevention. So the sooner you can get diagnosed, the sooner you can get treated.
You touch on a really important point, though. For all the years I worked in the emergency room, we would actually use those opportunities as a screening point.
Sure.
So if a patient came in and did have a distal radius fracture without significant trauma, it's a warning sign that there could be lack of sufficient bone density, and to get them into the appropriate specialist where they would get DEXA testing and other types of modalities to see, are they really at risk for a more severe fracture like a hip fracture?
Absolutely.
Correct?
Absolutely correct.
Yeah.
Right.
Okay. How about on the hands? You are a hand specialist. What are some of the more common types of problems you see on the hands? Are there masses or types of different issues with the tendons in the hands and fingers?
Sure. So I think one of the most common things we see is trigger fingers, which are locking or snapping fingers, typically from overuse or from, again, genetic predisposition. Some people can develop swelling, have trouble moving their fingers, they're stiff in the morning, and they actually can sometimes get clicking. Could affect any one of the digits. That's a common one that we see, and it's an easy one to treat. Most of the time, these are treated with injections, and patients can go about their business and back to their previous activity levels. Masses, super common, lumps and bumps as we call them. Most of the time, the good news is about 95% of masses in the upper extremity tend to be benign, but they just need to be diagnosed, so we could either monitor them or potentially treat them. But extremely common problem and an easy one to take care of if diagnosed quickly and appropriately.
Okay, wonderful. Thank you for joining us, Dr. Cristoforo. When we get back, we'll continue to talk about St. Catherine and St. Charles Center for Health and Wellness. Please stay tuned to CHS Presents Health Connect right here on Telecare.
I'm getting older. Do I need to worry about falling?
Yes, you do. Every year, 1 in 4 people 65 and older will experience a fall, and many result in serious injury. The majority of falls happen at home, so take a look around. Replace bulbs and add lighting to help you see obstacles. Remove things that can make you trip. Fix uneven steps and floors, and install handrails in bathrooms and on stairs. Consider balance or strength training exercises, which can help with agility. Get your eyes and hearing checked regularly. Changes in your hearing can affect your balance. To learn more, please talk to your doctor about steps you can take to help prevent a fall. You can also visit aarpfoundation.org or medicaremadeclear.com/falls. This message was brought to you by United Healthcare and AARP Foundation.
Guess what? I have some news for you. There's free food right there, junk food. You see that truck? Oh, jeez. It's a 2 Michelin star chef. All for free, ladies and gentlemen. All for free.
Here we have a panzanella with summer vegetables and pesto. Enjoy. How we doing?
Fantastic. So what do you got going on underneath that plate there?
This food is really about to be thrown away.
Yeah. Bro?
Is there something wrong with this food? Where did you get it from?
From farmers markets. They put aside the ugly vegetables and the ugly fruits.
Carrot top, soft avocados. It was all food that was going to be discarded.
Even the drink you had is made from like a little bruised peach. Did it taste a little bruised?
Great. It was good.
The average person throws away 24 pounds of food a month.
That's a lot.
Isn't that a lot? Go visit savethefood.com for more information. Thank you. Junk food time!
When I lost my sight, the only thing I had was reading.
When you discover you have an impairment, it can change your life. So take a little time to find the resources that are going to help you restore what you've lost.
Whatever your needs are, 99.9% of them can be met by the NLS program.
There's all kinds of formats that you can choose from. You can choose from large print or braille or audio.
Just can't recommend it enough. It's a free service. It's amazing how much you can get.
It has expanded my horizon.
And everybody can read the way they want to read using this program.
For more information about the National Library Service for the Blind and Physically Handicapped, Library of Congress, visit loc.gov/thatallmayread or call 1-888-NLS-READ.
Hart, what's going on? I'm leaving. Why? What did I do? Not enough. You constantly ignore me. You barely eat anything healthy. You're half as active as you used to be. The pressure is just too much. I quit. Okay, I get it. I'll do better. Just, please, don't leave. Okay. But remember, if I go, you go.
Listen to your heart. Don't let it quit on you. Uncontrolled high blood pressure could lead to stroke, heart attack, or death. Get yours to a healthy range before it's too late.
Welcome back to CHS Presents Health Connect. We've been discussing St. Catherine and St. Charles Center for Health and Wellness and are now joined by Dominic Pernice, Director of Imaging Services at St. Catherine of Siena Medical Center and St. Charles Hospital and the Center for Health and Wellness. Welcome, Dominic.
Thank you.
It's great to have you here. Tell our viewers a little bit about where the new center is.
So the new center is located at 500 Comac Road in Comac, and it offers easy access and plenty of parking in a spa-like office.
And tell a little bit about what types of services are offered at the center. This is a multi-specialty center. It's not, I know you're the Director of Imaging, but there's a whole host of services being offered there.
It is. So we offer MRI services. We offer digital X-ray, CT, as well as ultrasound. And we also offer all the low-dose technologies that you'd see in a hospital setting.
So low-dose radiation CT?
Correct.
Very important. Let's talk a little bit about that.
Absolutely. So low-dose CT is extremely important. We take it very seriously at the hospital, and we've rolled that out to the imaging center. So now that you have the same low-dose technologies you have in a hospital setting, now located in the community.
That's excellent. And you mentioned everything is digital, right? So, I mean, when I started working clinically, we had the old films. We used to put them up there, all computerized, all digital. So as our patients come in, they get electronic digital copies on discs of all their
They can get
studies.
a CD, and their doctors that are affiliated with CHS also have access in their electronic medical record. So those images actually get stored in the electronic medical record.
Get connected right in.
Correct.
That's incredible for patient care.
It's a huge advantage of being part of the system and also being in the community.
So it's wonderful. State-of-the-art technology, latest and greatest. Talk a little bit, though, about the quality of physician, which is very important, about
Absolutely.
the radiologist.
So we have board-certified, subspecialty trained radiologists that read our studies. They are the same board-certified subspecialty radiologists that are reading in our hospitals throughout CHS.
So now, our viewers may not know all the different degrees of specialization, but to kind of spell it out a little bit further, when you're getting a specific area of your body image, there are actually subspecialists reading that. So
Sure.
if I was getting my head imaged, we have what are called neuroradiologists,
That's
correct?
correct.
That are subspecialized in that particular area.
They did extra fellowship training in those specialties. We have musculoskeletal, we have body imagers, we have people that specialize in the brain.
That's wonderful. So really state-of-the-art clinicians with state-of-the-art technology, you marry that together,
It's a great
wonderful results.
combination.
It's a great combination. You have what's called a caring suite used in the new MRI suite. What is that?
So MRI sometimes comes with patients that are claustrophobic. This is aimed at reducing anxiety. The technologist that is controlling the MRI machine could also control the environment. They have ambient lighting, they have overhead televisions. They could give you any type of music that you want. You just name it. They stream it into you while you're having the examination, and it's aimed at really reducing anxiety.
I wish you would have told me about this when I needed my MRI. I'm one of those types of patients. I could have used a little relaxation and some good music.
It's worked well. Patients really rave about it, especially those that are a little bit apprehensive about having an MRI.
And it's a real entity. And I know, all kidding aside, it could be very nerve-wracking for patients going in and that feeling of being claustrophobic and whatnot. So that's
Absolutely.
just an extra wonderful touch that you add on. How do you get an appointment? Talk to our viewers a little bit about the availability.
Okay.
I know this is really important today in consumer and customer service models. So can they come in, same day be seen? How about when the studies get turned around? Is it same day?
So really, we offer same-day appointments for most procedures. And that's great. And the board-certified radiologists that are physically at our site are providing same-day reads. The reads are sent directly to the physician's office.
Wow, that's great. We talked about that a little bit with our last guest, Dr. Cristoforo. So in other words, patient can come in, be evaluated, be seen, go down the hall, get the tests, and many times, by the time they're done, the diagnosis is back.
They have a care plan ready to go before the patient even leaves.
That's wonderful.
Outstanding.
That's wonderful. Thank you for joining us today, Dominic.
Thank you for having me.
Wonderful having you. And now for my health tip and solution of the day. I'd like to speak to you today about summer safety. Before you head out to the pool, beach, or even your backyard, whether home or on vacation, keep these summer safety tips in mind. As always, I like to offer one source of truth, and that is the American Cancer Society, www.cancer.org. Did you know that skin cancer is the most prevalent form of cancer in the United States, according to the American Cancer Society? Go to www.cancer.org and search for skin cancer. Although melanoma accounts for only 2% of all skin cancer cases, it is estimated that in 2017, 10,000 people will die from the disease. In fact, melanoma is responsible for the majority of skin cancer-related deaths and is one of the more rapidly increasing rates of cancer. This dangerous cancer occurs in pigment-containing cells in the skin, eyes, and other organs. Just a few serious sunburns can increase your risk of skin cancer later in life. Remember, your skin needs protection from the sun's damaging UV rays whenever outdoors. Don't forget, skin cancer can develop anywhere, even on areas that are not routinely exposed to the sun. The American Cancer Society site also offers the ABCDE rule, advising us to look for some of the more common signs of melanoma. A, for asymmetry. One part of a mole or birthmark doesn't match the other. B is border. The edges are irregular, ragged, notched, or blurred. C is for color. The color is not the same all over and may include shades of brown or black, sometimes with patches of pink, red, white, or blue. D is for diameter. The spot is larger than a 1/4 inch across, about the size of a pencil eraser. And E is evolving. The mole is changing in shape, size, or color. To protect your family and yourself from potentially harmful ultraviolet rays, which can lead to melanoma and other skin cancers, be cautious outdoors, especially between the times of 10 a.m. and 4 p.m. If possible, avoid being outside during these peak hours. Check the UV index and remember that sand and water reflect sunlight. Beach sand can reflect the sun's rays, causing a fair skin to burn quickly. Be sure to apply the maximum water-resistant SPF daily and reapply often. Wear sunglasses, hats, long sleeves, pants, and skirts when necessary. Extra care must be taken to shield infants and young children from harmful rays. Also, staying cool when temperatures get hot isn't just about comfort. Dangerously high temperatures can cause heat-related illnesses and increase the risk significantly as temperatures rise and outdoor activities become more popular. Be sure to stay hydrated. Pay attention to your body and think carefully before starting new high-impact or stressful activities in extreme heat. People suffer heat-related illness when their bodies cannot compensate nor properly cool themselves. The body normally lowers temperature by sweating, but under some conditions, sweating is just not enough. In such cases, a person's body temperature rises rapidly. Very high body temperatures may damage the brain or other vital organs. While exposure to sunlight and the warmer weather can be enjoyable, too much can be dangerous. Don't ignore warning signs and other health issues that can occur more often during this season. That's my tip for today. You can view more of my health tips on CHS's YouTube channel. If you'd like to know more about the Health and Wellness Center, please visit chsli.org. From there, you can click through to the websites of each of our healthcare partners for more information on ways to give. We're always grateful for the community's support because your gift today helps shape the healthcare of tomorrow. Thank you for watching today. If you have any medically related questions you'd like me to answer on future shows, please email us at healthconnect@chsli.org. Please include your name and a way to contact you in case we need to reach you. I'm Dr. Patrick O'Shaughnessy, and I hope to see you next time on CHS Presents Health Connect.